listening to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on 101.7 FM Real Radio, WCZR, and this is also podcast on Spreaker. Jeannie Roller's with me today. We are talking about, Jeannie, this is your subject about, we're going to go back and talk about dignity and respect and, what patients can assume. Can we assume what patients should be able to have as their care for any kind of surgery that they go in for, and what they shouldn't have, and what rights we actually have, and on and on and on. We've talked about this so many times. We had a doctor on, Dr. Rich, for a couple of podcasts talking about how getting into concierge medicine has really brought back a lot of this respect. Well, for them, it hasn't gone away, and the dignity and modesty and what all this is. And what we consider, those of us that have been in the healthcare arena for quite a time as patients, harken back to the old days of when, we actually were patients and people, and we find now recently that it's getting to be more, in a lot of instances, what I coined the term big box healthcare, because it's take a number, what's your date of birth, what's your medical insurance, and, take a seat and we'll be with you in a minute, and your appointment literally seems some days like it only lasts a minute, but the waiting time to get in for that minute is a half an hour, or whatever. I mean, I could ramble on all day about that. Nobody wants to hear that. But I mean, Jeannie Roller, your thoughts? I mean, are we real still people, or are we a number? I don't know.
Well, no. I mean, they're trained very early on to think of us as not being human, more like objects. But the thing I have found is that, especially here in the U.S., modesty is what they like to term dignity as being. And modesty, to me, and dignity are very different things. Because dignity, human dignity, we're guaranteed that by human rights. And most recognize, or most civilized nations recognize, that we are entitled to basic human rights no matter who you are or what you've done.
Right.
So dignity I define as, I don't wear low-cut blouses because I don't want to show my cleavage. I don't wear short shorts because I don't want my behind hanging out. That to me is modesty. That dignity is nurses, doctors, medical people. They all have the responsibility of making sure that they are not exploiting my body by unnecessarily exposing me, meaning that they don't need my whole body naked to do hand surgery. They don't need to leave the door open. They don't need to tell me I can't have a gown when I get a mammogram, that I'm just supposed to stand there naked from the waist up. Those things, to me, are things that they do that harm the mental health of those that they do it to. I've had people say, well, I don't care. Well, that's okay if you don't care that they don't care about you. That's fine. I don't have a problem with that. However, I was talking to one man and he said, well, I don't mind being fully naked the whole time because my female doctor said to me, well, I just take it off. And that gown cost me so much money that you just take off anyhow. And so I was thinking, well, Guy, aren't you a little concerned that your doctor doesn't think that you are worth at least at the most a couple dollars so that you're not being disrespected? And it's that kind of attitude that always leaves me amazed, that people don't realize that if they allow themselves to be disrespected by being unnecessarily exposed, that what else will a medical person do? If they don't respect you as a person, are they giving you the best care that they can? I mean, disrespect keeps traveling on down the road. It may start at, well, we don't care if we're exposing you. And it can go on down the road to, well, I don't really care if you get your medicine on time, or but so on and so forth. And I'm not saying that happens every time,
right?
But it is the avenue that further things can happen.
Well, it opens the
And
door for it. It opens the door for the instance that it could happen. The thing that I wonder about it, too, is when did this mindset start and why did it start? Because it didn't used to be that way. I don't want to sound like an old fuddy-duddy or whatever, but if you do watch some of the shows back from, maybe the 50s, 60s, whatever, movies, those kind of thing, there was certainly a whole other atmosphere going on. I mean, my own mom went to nursing school, and it was all about patient respect and dignity. And why does it seemingly now go to the number game, the money game? In my opinion, this is all my opinion, the insurance game, that's what it seems like to me. And what happened to us as patients? As people, as human beings, What happened to us? And the doctors, the same thing, and the nurses that are forced, if they want to be in the medical system, the healthcare arena, they're forced to work under these same stipulations as well. And I mean, it goes against so many people's principles. Many doctors that we've talked to, interviewed, certainly ones that I know, they don't want to be caught up in that. That's not why they got into medicine. And why are they forced to do that? That's got to weigh on their minds, too, when they're really in it for the right thing. So many of the people, the nurses and doctors and other technicians or whatever, then this is horrible for them, too. It is.
Right. Well, the other thing, Cindy, that bothers me is that why does the medical community get to define what bodily dignity is?
Mm-hmm.
To them, it is not an issue exposing me unnecessarily. That's not an issue. Mm-hmm. Because it's not their body.
Well,
so why do they get to?
Right, to the ones that subscribe to that kind of mindset. That's what I'm asking the question. How did that mindset even come into play in an industry? And that's what the healthcare arena is. And it's an industry just like anything else. Where did that come from? Who started that? If we are doctors and we are nurses that have taken, the ones that work there, not myself, the oaths, where did that come from? I don't get it.
Well, I think it's come from many, many years. It starts early. It starts in nursing school. It starts in physician school, medical school, that patients are not people. And, the doctors start early with the pelvic rectal exams about not asking permission to do them, that they have a person who's already been drugged, who cannot say no. I just interacted with one doctor or medical student, and she felt bad about this because she felt that these people were being used, which they are. Mm-hmm. It is medical rape. If you don't specifically ask that person permission, saying we're going to have a group of students in here practicing giving you rectal, and a lot of times for men, that's what they get, and for women, the pelvic exam. Mm-hmm. It is rape because it benefits no one but the medical students. So that is the very definition of what rape is. It benefits one person. Mm-hmm. And people don't understand that. And they're taught that in school very early, that they can do this, that they don't have to have permission because that is not a person, that is an object.
Mm-hmm. Well, I don't know about the person and the object thing. I'm not going to say that. On the other side to it, they did give permission. The patient did give permission in a blanket clause that didn't specifically mention that rectal exam or that pelvic exam. And we're talking about the things that are bothersome. We have like a minute left, that are bothersome, that are the intimate procedures, okay? When your breasts are exposed, your genitals are exposed, those kind of things. So thankfully, recently, and it went on a very long time and harmed very, very many people, that legislature has addressed that, and many states do have laws and stipulations about that finally. But, what did it take to get that done, to even admit that these things were going on when both sides of the equation, found out and knew? So the medical side and then the patient side finally found out about it. We were kept in the dark all along. So, and it's the mind-boggling. It's totally mind-boggling. So a lot of these other things, in my opinion, need to be addressed as well. Do you always want to have legislature involved? No. But, I mean, if you're not going to self-police, then something's got to get involved to save the patient and to save the minds of these doctors and nurses that are forced to do this too. Anyway, on that note, you've been listening to Planet Vero Radio. Stay tuned.